Hello, everyone. I am very excited to introduce you to your speaker today. His name is Dr. Robert Anolik, and if you are not familiar with him, then I don't know where you have been because he is in the media all the time. You may have seen him on the Today Show, and all these celebrities talk about him on their own Instagram. So I want to name drop here a little bit, if that's okay. All of these celebrities have given us permission and have shared it themselves, but Kelly Ripa says that he is her Dr. Anolik is her true love. Dr. Anolik has also
Don't tell
had
my wife.
Dr. Anolik has also had the pleasure of treating celebrities like Christy Brinkley, Justin Theroux, Joy Behar, Stephanie Seymour, Mary Louise Parker, and so many more. And then Gwyneth Paltrow's Goop also noted him as a favorite and best in class. But my personal absolute favorite claim of fame of Dr. Anolik is that Town and Country magazine named him the Michelangelo of Botox and fillers, which is a very, prestigious thing to say. And we couldn't agree more. We are so grateful to have him at Laser Skin Surgery Center of New York. And he is going to teach you all today a little bit about some of the recent innovations in cosmetic dermatology, focusing mostly on injectables. So without further ado, Dr. Anolik, the floor is yours.
Great. Thank you so much, Risa, and hello to all of you. Um, when I heard about this webinar, I thought it would be interesting to discuss some of the recent innovations in cosmetic dermatology injections. Every year we're seeing new ideas, concepts, and uses of what we're using in the field. And as many of you know, we have a clinical trials unit that we work on here actively. And fortunately, we're part of a lot of these developments. Cosmetic dermatology injections really mean by and large, a category of neuromodulators, which are things like Botox and Dysport and many other products you may have heard about. And the other big category is augmentation fillers. And so I want to talk about some new concepts in those two fields. So there's a new hyaluronic acid injectable that we are using and excited about. Uh, these hyaluronic acids are becoming more than just volumizers, and we'll go into detail. And there's also a longer lasting neuromodulator that we're using. And I do think that these have a time and a place that I want to discuss. So with regard to the novel hyaluronic acid, it is known as Juvéderm Skin Vive. So what is hyaluronic acid? It is a natural sugar chain molecule, and it's already found in our skin. It's part of our skin anatomy, our skin function. It's something that we use commonly in dermatology, but under many uses. Many people have heard about it purely as an ingredient in moisturizers. A lot of tweens are going on TikTok learning about skincare, and a lot of them know about hyaluronic acid being a great moisturizer. And the reason it is a great moisturizer to put on the skin is because it has a strong ability to attract water. Hyaluronic acid is also the most popular filler material. There are others, but the most popular are the ones made out of hyaluronic acid. And those are big brands that you probably have heard about if you're familiar with our field. And those include things like Juvéderm, Restylane, Belotero, RHA, and we're going to see more and more and more coming about, and they all have different properties and benefits. Some are a little stronger and firmer for lifting on the lateral parts of the face. Some are a little bit softer to add volume, sometimes in the areas of the lip and the chin. So there's a variety out there that we choose from. Skin Vive, this newer hyaluronic acid injectable, really merges the concept of hydration of a moisturizer and an injectable component of hyaluronic acids. It's really a new class of in-office dermatology treatment. The injected hyaluronic acid of Skin Vive improves skin quality through the hydration as opposed to the volumization that we see with, I'm sorry, I'm getting something on my screen here. Okay. As opposed to volumizing. So I like this visual because it's a little bit of how I see my use of Skin Vive. I can now deliver hyaluronic acid droplets in the top layers of the skin, giving our patients long-term hydration and visible smoothness. I put together a little video just to show you what it looks like to have this done. So here we go. So you can see that I'm using the syringe and injecting just tiny droplets right in the deep dermis and underside of the skin, almost like in a grid pattern. If you're a patient, you might also recognize Trish, who I'm treating, who you may know has a good sense of humor and either just told us a joke and that's why she's smiling, or she's laughing at one of probably our dumb jokes. It was actually a very tolerable procedure because the needle is so fine. She didn't even numb for that procedure. This is an image from some of the clinical trials that Allergan organized when they were getting the approvals and defining how to use a SkinVive. In this case, you can see baseline versus a month, and I know it's sometimes hard to see on PowerPoint, and I hope the lighting does reveal it, but typically the skin looks a little softer and a little bit brighter because of the hydration of the hyaluronic acid SkinVive right under the surface of the skin. The clinical trials showed that patients who received SkinVive reported very high satisfaction with their skin appearance, and patients also described that their skin was glowing, hydrated, refreshed, and healthy for up to 6 months after treatment. So who doesn't like the idea of that? So this is why it's been popular among many of my patients. And now I wanted to move on to neuromodulators. So we're moving away from hyaluronic acids in the office and instead a new concept in the use of neuromodulators, in this case, a brand known as Daxxify. So neuromodulators in general is an entire category of injectables, different than augmentation fillers, that reduces lines caused by muscle contraction. So the classic example is the 11 lines between the brow where the muscles contract, make wrinkles that we don't need. This category includes things like Botox Cosmetic, Dysport, Xeomin, Jeuveau, and now Daxxify. I thought it would be interesting to go into the technical side of things a bit for those of you who are curious. This is essentially my attempt to describe the mechanism of action of FDA-approved neuromodulators. If you imagine the yellow line there and above, that would be the cell of the nerve. The pink line and below would be the cell of the muscle. And what I'm trying to show here is that there are these little balloons, we call them vesicles, that are full of these little black dots, which represent a molecule called acetylcholine. And that approaches the membrane of the nerve, and it releases the acetylcholine, or these little black dots, into the junction, which touch the muscle and cause the muscle to contract, and the muscle creates the wrinkles that some we want, and some, like the ones between our eyebrows, many people don't want. Those little balloons or vesicles can't just join the cell membrane and release and affect the muscle, because if that happened in an uncontrolled way, we'd be contracting our muscles irregularly. So there are some proteins that are in our cells that allow us to release those little balloons, and they're called snare proteins. So the way these neuromodulators works, represented by this BTA that you see here, it holds onto the membrane, enters the membrane of the nerve, and it has the ability to cleave some of these proteins known as snare proteins, so that the little balloon cannot attach to the nerve membrane and release and make contact with the muscle. So it cleaves that little protein, and then it no longer can attach and release the acetylcholine for the muscle contraction. Daxxify is a new, what we call botulinum toxin type A product, which is essentially what the neuromodulators are. It integrates a stabilizing, positively charged peptide. And this peptide can bind to the neuromodulator molecule, and it also can bind tightly to the cell membrane of the nerve. The idea is that the neuromodulator protein is able to survive transport more easily from the vial to the syringe and into the skin, making the impact that we want, and it can get absorbed even in greater quantities into the nerve, creating a greater impact that we're trying to achieve. In this case, the neuromodulator there represented the BTA is there, but imagine that there's a stabilizing protein around it, allowing it to bind more easily. In fact, more would survive transport getting to that nerve membrane, and more can be taken into the cell and causing the breakdown of those proteins that can prevent the contraction of the muscle and prevention of the wrinkle that we're trying to achieve. These are some photos from the clinical trials, and you can see at baseline, the patient has pretty deep lines. And at 4 months, which is the bottom left photo you see on your screen, the 16-week period, you can see that she still has some benefit from the treatment with the neuromodulator. The lines are not nearly as deep as they were to begin with. And even out to 6 months, you can see lines starting to creep back, but we're getting a nice duration that extends past that 4-month mark, which is what we're used to seeing as an endpoint, where the benefits of the neuromodulator and the diminishing of the wrinkles is still present. So it's pretty exciting. So who is the best candidate for this sort of longer lasting neuromodulator? It depends. The traditional neuromodulators that we've been using for many years are still wildly popular for many reasons. A longer lasting version would be popular among those people who will not be able to return 3 times a year or just cannot. They choose that they don't want to be in an office so frequently, or some of our patients live in Europe or Asia or South America, and they just can't be here as frequently. So they make a good candidate. People who are not really desiring the opportunity to be able to tweak the benefits of what we're trying to achieve are also good candidates. Some people like the idea that between 3 to 4 months, they can come in and they can modify this area or this area. And if you use something a little longer lasting, you really can't modify that anymore. And then, of course, there's tremendous benefits to these procedures, but there are, of course, always some level of risk. And those low risks, which are present, could last longer if they occurred, and we use something that lasts theoretically longer. So in conclusion, there are a lot of innovations in our field, including the hyaluronic acid injectables, and we're now able to deliver smoother and hydrated skin using SkinVive. And we're also using a novel neuromodulator that allow us to extend the duration of effect of the neuromodulator, in this case with Axify. So thank you, everybody. I hope that was clear and helpful. If you have additional questions, feel free to reach out to our organization.
Yes, thank you so much, Dr. Anolik. And I just want to thank everyone for watching and listening. And if anyone has any questions, the practice name is up here. It's the Laser and Skin Surgery Center of New York. And we would love to see you anytime. So thank you, Dr. Anolik, and we hope to see the rest of you soon. Bye.
All right. Thanks so much, Risa. Bye-bye.